Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is packed cell volume and blood indices. So today we will discuss about the definition, method of determination, signification of determining normal values, variation, blood indices, then importance of blood indices, then different blood indices, and then the calculation of blood indices. So let us start. First of all, what is packed cell volume? Packed cell volume is the proportion of blood occupied by RBC expressed in percentage. If it is the volume of RBCs packed at the bottom of a hematocrit tube when the blood is centrifuged, and it is also called hematocrit value or erythrocyte volume fraction or EVF. So what is packed cell volume? Packed cell volume is the proportion of blood occupied by RBC expressed in percentage. Okay. Now method of determination. Blood is mixed with an anticoagulant EDTA or heparin and filled in hematocrit or Winthrop tube up to 100 mark. Then the tube with the blood is is centrifuged at a speed of 3000 revolutions per minute for 30 minutes. Then the RBCs, which are packed at the bottom from the packed cell volume, and the plasma remains above this. In between the RBCs and plasma, there is a white buffy coat, which is found by white blood cells and the platelets. You can see in the diagram. This is the diagram. The packed red blood cell, then white buffy coat, and in the above level, this is plasma. In the laboratories with modern equipments, hematocrit is not measured directly but calculated indirectly by autoanalyzer. It is determined by multiplying the RBC count by main cell volume. However, some amount of plasma is always trapped between the RBCs, so accurate value is obtained only by direct measurement of PCV. Now, significance of determining the packed cell volume. Determination of packed cell volume helps in diagnosis and treatment of anemia, diagnosis and treatment of polycythemia, determination of extent of dehydration, and recovery from dehydration after treatment. Then number 4, it is decision of blood transfusion. Now the normal values of packed cell volume. A normal packed cell volume in case of male it is 40 to 45%, and in case of female it is 38 to 42%. Now variation in packed cell volume. Increase in packed cell volume. PCV increases in polycythemia, dehydration, then dengue shock syndrome, dengue fever, tropical disease caused by flavivirus transmitted by mosquito Aedes aegypti of grade 3 or 4 severity. Now you can see the diagram clearly. Now decreases in PCV. When the PCV is decreased, in case of anemia, liver cirrhosis, pregnancy, and hemorrhage due to ectopic pregnancy, pregnancy due to implantation of fertilized ovum in tissues other than the uterine wall, which is characterized by vaginal bleeding. Now blood indices. Blood indices are the calculation that derived from RBC count, hemoglobin content of blood, and PCV. Now, importance of blood indices. Blood indices help in diagnosis of the type of anemia. Different blood indices. Blood indices include mean corpuscular volume or MCV, mean corpuscular hemoglobin or MCH, mean corpuscular hemoglobin concentration MCHC, then color index or CI. Let us discuss one by one. First, mean corpuscular volume. MCV is the average volume of a single RBC and it is expressed in cubic microns. Now, normal mean corpuscular volume or MCV is 90 cubic micron, and it ranges between 78 to 90. And when the MCV is normal, the RBC is called normocyte, and when MCV increases, the cell is known as macrocyte, and when it decreases, the cell is called microcyte. And in case of pernicious anemia, the megaloblastic anemia, the RBC are macrocytic in nature. In iron deficiency anemia, the RBCs are microcytic. Then mean corpuscular hemoglobin or MCH. MCH is the quantity or amount of hemoglobin present in one RBC It is expressed in micron, microgram or picogram. Normal value of MCH is 30 picogram and it ranges between 27 to 32 picogram. The number 3, mean corpuscular hemoglobin concentration or MCHC. MCHC is the concentration of hemoglobin in one RBC. It is the amount of hemoglobin expressed in relation to the volume of one RBC. So the unit of expression is percentage. This is the most important absolute value in the diagnosis of anemia. Normal value of MCHC is 30% and it ranges between 30 to 38%. When MCHC is normal, the RBC is normocytic. When the MCHC decreases, the RBC is known hypochromic. In pernicious anemia and megaloblastic anemia, the RBCs are macrocytic and normochromic or hypochromic. In iron deficiency anemia, RBCs are microcytic and hypochromic. A single RBC cannot be hyperchromic because the amount of hemoglobin cannot increase beyond normal. Then color index or CI. Color index is the ratio between the percentage of hemoglobin and percentage of RBC in the blood. Actually, it is the average hemoglobin content in one cell of a patient compared to the average hemoglobin content in one cell of a normal person. Now, normal color index is 1.0 and it ranges between 0.8 to 1.2 and it was widely used in olden days. However, it is useful in determining the type of anemia. It increases in macrocytic or pernicious anemia and megaloblastic anemia, and it is reduced in deficiency anemia, and it is normal in normocytic and normochromic anemia. Now, calculation of blood indices. Blood indices are calculated by using different formula. The calculation requires the value of RBC count, hemoglobin content and packed cell volume. For example, in the blood of a male subject, the RBC count is 4 million per cubic mm, hemoglobin content is 8 gram per dl and packed cell volume is 30%. Now determine the color index MCV, MCH, MCHC. So let us calculate first color index. Color index is calculated by dividing the hemoglobin percentage by the RBC count percentage. So color index is equal to hemoglobin percentage by RBC percentage. Now hemoglobin percentage, how we can determine this? So hemoglobin percentage is hemoglobin content in the subject by hemoglobin content in the normal person into 100. Hemoglobin content in the subject is 8 gram and normally it is present around 15 gram. So 8 by 15 into 100 is equal to 53.3%. Then RBC percentage. The RBC count in subject is 4 million per cubic mm and RBC count in normal person is 5 million per cubic mm into 100, then it is 80%. By using these two values, the color index can be calculated as 53.3%, the hemoglobin percentage by 80%, which is RBC percentage, and the color index is 0.67, which is less than normal. Now, mean corpuscular volume or MCV. The packed cell volume in ml by 1000 ml of blood and RBC count in million per cubic mm of blood. Then packed cell volume in 1000 ml or in 100 ml into 10. Now RBC count in million per cubic mm. Then it is 30 into 10 by 4, it is 75 cubic micron. Then mean corpuscular hemoglobin. The hemoglobin in gram per 1000 ml of blood by RBC count in million by per cubic mm. Then it is also calculated as hemoglobin in gram per 100 ml of blood into 10 by RBC count in million per cubic mm. Then it is 80 by 4, it is equal to MCH is 20 picogram. Then mean corpuscular hemoglobin concentration or MCHC. Hemoglobin in gram by 100 ml of blood by packed cell volume in 100 ml of blood into 100. It is 8 by 30 into 100. So it is 800 by 30, then 26.67. So the results are color index 0.67. The normal range is 0.8 to 1.2. So it is less. MCV 75 cubic micron. The range is 78 to 90 cubic microns. It is slightly less, more or less nearer to the normal. Then MCH, it is 20 picogram, but the normal is 27 to 32 picogram. It is also less. MCHC 26.67%, which is also less. 30 to 38% is normal. Results of these indices indicate that the person is suffering from microcytic hypochromic anemia, which is commonly occurs during iron deficiency. So this is our today's topic, the packed cell volume and the blood indices. So I think you guys have already understand all these topics very clearly. So if you have any query or any doubt, you can comment down in the comment section, and do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching the entire video.